Hello and welcome. My name is Nargis Bassett and I'm posing as a patient care advocate for my research topic presentation. So let's get started. Hello, future parents. I am a patient care advocate who works closely with pregnant women to help ensure that they are informed, empowered, and supported throughout their childbirth journey. Today, we are going to discuss scheduled C-sections, why their rates are rising, especially in urban hospitals across the United States, and what this trend means for you, and how you can confidently advocate for yourself by asking the right questions. Over the past decade, scheduled C-sections have dramatically increased, especially in urban hospitals across the United States. While C-sections can be life-saving and necessary in many cases, we are seeing more and more of them scheduled when they may not actually be needed. That's where your role as an informed patient becomes critical. To be clear, this video is not about disregarding medical advice, but making sure that decisions are informed, evidence-based, and centered on your values. So let's take a moment to understand why there has been an increase in scheduled C-sections in the United States over the past 10 years. We need to establish the difference between a scheduled C-section and an emergency C-section. A scheduled C-section is when a provider has planned in advance to deliver a child through a surgical intervention called a cesarean section. There are many reasons why a provider has decided on this delivery method, which we will further discuss in this video. On the other hand, an emergency C-section is a cesarean surgery performed when unexpected complications arise during labor that threaten the health of the mother and/or baby, such as fetal distress, uterine rupture, or placental problems. While medically indicated C-sections are critical and life-saving, research shows that not all scheduled C-sections are medically necessary. So why are they increasing? Let's review some contributing factors for why a provider would schedule an unnecessary C-section. One reason may be for convenience of the provider. Scheduled C-sections allow doctors to plan deliveries around their work hours, vacations, or hospital scheduling needs. Unlike natural labor, which can be unpredictable, with some patients in labor from anywhere from a couple hours to a couple of days. Another reason may be for financial incentives. In some healthcare systems, C-sections can generate higher revenue compared to vaginal births. This can unintentionally create pressure to recommend surgical births more often. Additionally, some providers may have fear of labor complications. Some providers may prefer to preemptively schedule a C-section to avoid potential complications with vaginal delivery, even if the likelihood of those complications is low and the risk of surgery are higher. When a provider elects for a scheduled C-section that isn't medically justified, it places mothers and babies at unnecessary risk. Some mothers are undergoing this major abdominal surgery without fully understanding why, or without being offered the chance to explore alternatives. This is a problem that we can solve through education and advocacy. Let's look at the risk and benefits of both delivery methods so you can ask better questions to make informed decisions about your birth plan. Your provider should be able to answer questions like, what are the short and long-term risks of scheduled C-section for me and my baby? For mothers, common C-section risks include longer hospital stay and recovery time, increased risk of infection or serious blood loss, hormonal disruption, higher risk of complications in future pregnancies such as placenta previa, placenta accreta, uterine rupture, possible impact on future fertility, and many more. For babies, these risks include increased risk of respiratory issues, both short and long-term, short-term such as transient tachypnea and long-term such as higher risk for asthma and respiratory tract infections, low APGAR score, which could lead to possible NICU admission, metabolic and immune system challenges, potential fetal injury during surgery, and delayed bonding or breastfeeding difficulties. As for the benefits of a C-section, your provider may provide reasoning such as avoiding potential labor complications, reducing risk of fetal distress, delivery via controlled environment, reduced labor pains, and planned delivery. Now let's compare this with vaginal delivery. A good question to ask your provider is, Can we review the risk and benefits of vaginal birth in my specific case? Some common benefits associated with vaginal births in mothers are faster recovery, lower risk of infection, lower risk of complications in future pregnancies, earlier skin-to-skin contact and initiation of breastfeeding, lower cost, and active participation in the birthing process by being more in control and having alertness during labor. Benefits for the baby include exposure to beneficial bacteria that aid in immune development, better clearance of lung fluid, which reduces the risk of respiratory issues, lower risk of certain long-term conditions such as asthma, allergies, type 1 diabetes, and obesity, and a quicker adjustment to life outside the womb. Although there are many benefits to vaginal delivery, there are also several risks that we shouldn't overlook, such as perineal tearing, hemorrhaging, pelvic floor injury, intense pain and long labor duration, risk of fetal injury, and possibility of needing emergency interventions such as an emergency C-section. All that being said, we can conclude that there are several risks and benefits to both delivery methods, and your birth plan decision is unique to your situation. There is no one-size-fits-all answer, as your pregnancy journey is not the same as another woman. Your birth plan should reflect your individual health needs and values. That's why informed consent and open dialogue with your provider are so important. So, what should you do if your provider has recommended a scheduled C-section? The first step is to fully understand why this delivery route is being suggested. Don't be afraid to ask direct questions. Here are a few that we can start with. Can you explain the specific medical reason for recommending a C-section? Is it based on a prior C-section, a current medical condition, or a standard hospital practice? Are there other safe alternative options to consider besides a scheduled C-section? For example, is an assisted vaginal birth or a vaginal birth after a C-section, also known as a VBAC, an option? Is this an emergency, or is there time to explore alternatives? Many C-sections are scheduled out of convenience or fear of potential complications, not because there's an immediate danger. If there's no immediate danger, you should be given ample time to think about your decision. And lastly, what are the risks if I wait for labor to begin naturally? Providers should give you an individualized answer based on your health and your baby's health. Statements like, your baby is big, or you're past your due date, often prompt for a scheduled C-section, but these factors alone don't always justify surgery. It's important to clarify whether the recommendation is rooted in your specific medical needs or just preferred practice. It's important to remember that your provider cannot force you to make a certain decision on your birth plan. You have the right to informed consent. That means understanding your options, asking questions, and feeling comfortable with the decisions being made. Your voice matters, and you have the right to make your own decisions when it comes to your body. Consider asking your provider questions like, what would happen if I declined the scheduled C-section and waited for natural labor? Is this a recommendation influenced by hospital policy or provider preference? What is your approach to supporting natural labor and minimizing interventions? And most importantly, can I get a second opinion? If a recommendation feels rushed, vague, or uncomfortable, listen to that instinct. You are allowed to pause, seek clarity, and make decisions that are right for you, your body, and your baby. Now let's talk about equity, or the lack of it, in maternity care. Data shows that Black, Indigenous, and women of color are more likely to be recommended C-sections, even when not medically necessary. These disparities are rooted in systemic racism, implicit bias, and historical mistreatment in healthcare. Low-income women, especially those on Medicaid, also face higher rates of scheduled C-sections and often have less autonomy in their care. Limited access to doulas, birth education, and provider continuity plays a role here as well. Studies have found that in some hospitals, institutional policies and provider habits are the strongest predictors of C-section rates. Other risk factors for higher scheduled C-section rates include being over the age of 35, which is considered advanced maternal age, living in highly urbanized areas, giving birth at a high volume or teaching hospital, having a higher BMI, or having history of a prior C-section, especially when VBAC is not encouraged. If you fall into any of these categories, being an informed patient is even more essential for you. Here's what you can do. Bring a trusted birth advocate, doula, or support person with you to appointments and delivery. Ask questions and write down the responses. Seek a second opinion when something doesn't feel right. You have every right to be heard, respected, and involved in the decisions that impact your birth. In conclusion, the bottom line is this. C-sections absolutely save lives, but only when medically necessary. You have the right to ask questions, seek second opinions, and make informed decisions about your birth. By staying informed, you can avoid unnecessary interventions, protect your health and your baby's, and ensure that your birth experience reflects your values, not just your provider's preference. If you need help crafting a birth plan, finding supportive care, or preparing for conversations with your OB, I'm here to support you. You are your own best advocate, and I'll stand beside you every step of the way. Thank you.